So this one is Clostridial myonecrosis. And so this one is also known as gas gangrene. That's what Shane and I were talking about before we got started. Different variation of gangrene. Gangrene in this case is one that before antibiotics, especially during some of the more violent wars, such as War of 1812 and World War I and Civil War and things like this, before antibiotics were prevalent or even known, this would be what killed most people because the weapons at the time were not that great. So they're shooting a musket ball at you. Well, it may maim you, may put a hole in your arm, it may hurt a lot, but at the end of the day, it wasn't usually a life-threatening wound. What actually was killing these people was the gangrene that would set in afterwards because of the wound and that they didn't have the ability to actually fight off the infection. Imagine you're part of the army and part of the military, and you are just basically living in a field in a tent, right? This would be back before there was even proper, healthcare facilities. So the hospitals were usually field hospitals, no antibiotics. So a lot of these individuals died of things like gas gangrene. So what is it? Well, first of all, it's going to start out as severe pain and swelling, lots of fluid leakage from the actual wound site. This is going to be not only pus, but also some blood could be coming through. And it may look frothy because of the bubbles that are being formed. So what's actually happening here is the bacterium is doing its metabolism. It's just doing its thing. And it's releasing gas as a byproduct. That byproduct then gives the manifestation of this disease. And so that's where the gas bubbles are coming from. It's coming from the bacteria's metabolism. What occurs then is, just think about it. It's like me trying to pump air underneath your skin. Your skin is pretty watertight for the most part. And so, if I start pumping air underneath the skin, it's going to start expanding. It's going to start pressure just like a balloon. But eventually, there's going to be parts that give way and break. And that's where we start seeing the frothiness, the blood pus coming through. And unfortunately, the victim actually, is in an incredible amount of pain, very cognizant, because it's not necessarily going septic yet. It's just causing an immense amount of pain. So they really are very alert to what's happening to them. But then they'll go delirious because of the pain, as well as it starts going septic. They'll fall into a coma, eventually die. So the causative agent can be a lot of different variations of Clostridium. So remember, anytime you see the genus Clostridium, Clostridiums always are anaerobic. They are always found in the soil, and they also can form endospores. That's key pieces of what makes a Clostridium a Clostridium. So it makes sense, when we start looking and you go back and you see all these different diseases that are found in wounds, a lot of them are anaerobic bacterium, because in order for you to acquire a wound, that means that there was some sort of puncture or some sort of break in the skin. And those bacterium that are normally anaerobic, you put them from one anaerobic environment, like say the soil, right straight into the sterile tissue of your body, which is going to be anaerobic to an extent. And so you basically put them right where they like to be. And they're going to start creating these disease manifestations. So it makes sense when you look at the causative agents that they're Clostridiums, because those are anaerobes. This one in particular that we're going to talk about that's most common is one called Clostridium perfringens. And that, is one that usually we see associated with gas gangrene. So, as I already said, presence of pathogenesis, presence of dirt in the wound. So it's probably going to be some sort of outdoor injury, not necessarily going to be a gunshot per se, unless it's one that has been festering for a few days. Maybe they're afraid to go to a hospital or something like this. For the most part, these are going to be wounds that come from, accidents, more or less. Long delays before the wound is treated. That's what I'm saying, maybe not getting to the hospital in time. The Clostridium perfringens cannot infect healthy tissue. So it actually has to be damaged, dead tissue that Clostridium actually is getting into. So if it's oxygenized tissue, like very healthy oxygenated tissue, Clostridium perfringens can't live there because it's an obligate anaerobe. And so one of the treatments that we'll see here in a second is oxygenating the person, putting them in a hyperbaric chamber, essentially trying to increase the oxygen levels in their skin or in their body. So alpha toxin, this is produced by, there's a toxin involved that allows this bacterium to give its pathogenesis. It's going to destroy the cell membranes, and when that happens, you get cell lysis, right? If you kill remember eukaryotic cells, we don't have a cell wall. We don't have any other protection. We don't have those capsules. Eukaryotic cells simply are just that phospholipid bilayer. And this particular toxin destroys that phospholipid bilayer, instantly lysing the cells and killing the host cells pretty quickly. There's also collagenases and hyaluronases there, and they're going to be helping it spread, right? If I'm able to chew through the collagen, then I'm able to continue spreading further and further along. Without surgical treatment, the toxin will continue to diffuse, get into the bloodstream, and then it's usually in-game because it's going to start destroying red blood cells and ultimately put the person into a coma and die. Treatment and prevention, and we'll come back to epidemiology. Treatment and prevention is the same as we've seen with necrotizing fasciitis. You need to cut it off, cut the tissue out, possibly do some sort of cutting of limbs off, if it's necessary, to ultimately try to stop the spread and preserve the person. Sometimes we have to just go start lopping tissue and limbs off. The antibiotics are going to be useful to clear the bacterium, but remember it's a toxin that's causing the problem, so we also have to deal with the toxin. As I already pointed out, a hyperbaric chamber can be useful because this bacterium is an obligate anaerobe. So if I can increase the amount of oxygen that's in the person's body, sometimes that can be an effective treatment too. There's no available vaccine. So ultimately, the way that we prevent gas gangrene is to not allow a trauma wound to be neglected. If you have a major wound, get it treated. Get it cleaned up and get it sutured or stapled and ultimately move along. This is only going to happen in people that tend to allow their infections or allow their wounds to go on for several days without proper treatment. All right, so the next one is acetomycosis, and so this is an interesting one because the name. If you haven't started picking up the name myco, because we don't really cover them that much, myco means that it's a fungal disease. And so this one still carries the name of acetomycosis, but at the end of the day, it's not a fungal disease. It was something that was thought to be a fungal disease, and then after more and more diagnostic and research was done on it, it was actually realized to be a bacterium. But what this particular bacterium is Acetomyces israeli is the name of the bacterium, and what's interesting about this particular genus of bacteria is that it's actually at the highest level in the hierarchy of prokaryotes. It actually has a lot of features that makes it look like or act like a eukaryote, even though it's still prokaryotic. And that's why there was this mistake of actually misidentifying it as a fungal infection. Point being is that a lot of times when it's able to be very self-reliant, a lot of times they're not as pathogenic. And so this particular bacterium does manifest into this disease, but it's not a very dangerous, per se, disease. So here it's got the nickname lumpy jaw. And what occurs here is it's very progressive, painful swelling that happens, and then it goes away, and then it comes back, right? And so this is going to be something that the person is going to experience happening over and over again. So slowly progressive, sometimes painful swelling under the skin that usually bursts, the pus drains, the abscess goes away, and then it may manifest again later. Opening usually heals only to repair its same or different areas within days or weeks later. So they may think, oh, that was terrible. It pops, it goes away, and they think, oh, it's fine. And maybe a week later, it's back. And it just continues going through that cycle. It's usually going to be on the jaw and neck, but it can also be on the chest, abdominal area, and sometimes in the genital tract of women. Again, the causative agent there is Acetomyces israeli. We don't really understand much about it. And when we start getting into some of these diseases, as we continue into the last 4 or 5 chapters we got, a lot of these diseases, when we see things that say detailed mechanisms are not established, that's not because it's difficult. That's because there's really no money for the research. This is not a disease that necessarily is going to demand, a lot of money being, donated to lumpy jaw, awareness and, to help in the research areas. And so therefore, there's not a lot of people working on it. Detailed mechanisms are not very established. the actual bacterium cannot penetrate normal mucosal surfaces. So it's not designed to be a pathogen by nature. It's an opportunistic pathogen. And the only way it's going to establish an infection is if it's introduced into a wound. So the one of the telltale symptoms that we can see is this yellowish colonies when we look at it under the microscope, and we call those sulfur granules, because sulfur, if you look at sulfur as an actual molecule, it has a yellowish color to it. So, underneath the microscope, it looks like these little grains of sulfur, but that's not what it is. It just happens to be the colors that this particular bacterium grows. So a pathologist getting a sample of the pus sent down to be looked at, that'd be one of the things that would be a tell for aiding in identification. Epidemiology, it can be part of the normal microbiota, the mouth, upper respiratory tract, intestines, and sometimes the vagina. Therefore, that's why it's found in the genital tract of women, is that if there's a wound, internal wound, then this natural normal microbiota that's there could potentially develop into these symptoms. However, disease is sporadic and is not transmitted person to person, so it is just really a flukish thing. It's not really anything that we necessarily can worry about or prevent. More than anything is just taking care of the wound. Antibacterial medications over weeks or months, because the organism grows slowly, just like when we talked about tuberculosis, where you have to stay on the medication for a long period of time. The bacteria is slow growing, and therefore any sort of antibiotic that we give that's bacteriostatic or bactericidal still relies on working only when the bacteria is actively replicating. So if it's growing slow, you have to take the medication for long periods of time too. The next one here is one that is actually probably one of the most common reasons why somebody might find their way to an urgent care and emergency room. That is a wound related anyways. These are going to be animal bites. So animal bites constitute over 3 million entrances into the clinics nationwide. And what's happening here, we got to think that going back to the definitions of wounds, dog bites or animal bites can constitute 3 of those 6, at least just right here on this slide. You have crushing, right? So crushing of the tissue, which would be similar to a contusion. It doesn't necessarily break the skin, but it's damaging the tissue underneath. Laceration, remember laceration is when it's not a clean cut. Again, that would make sense from a teeth bite, be lacerating the skin. And then puncture. So think the fangs puncturing right through. Now, animal bites are bad enough, but the next part there is where we actually have the problem is human bites. And why would a human bite be more serious than a dog bite is because the microbiota of humans are the same. Right? A dog's going to be carrying a different normal microbiota than a human. And so human to human bites actually are more dangerous than animal bites. So these are actually common. The results can be serious just from the normal microbiota, but it can also transmit whatever that person may be infected with too. So we do have cases of things like syphilis, tuberculosis, Hep B and C being transmitted through human bite. So this is never a good thing, right? Wounds appear minor, but then again, so you're talking about one that actually bit right through you and you have blood. You may not, if you don't clean it or have it treated right away, you can ultimately start seeing some of the other things, the swelling that comes from the inflammation, eventually pus that's going to be coming out that's going to have that bad smell to it. That bad smell is coming from the metabolism of that bacteria that's inside the wound. So you get that smell is usually coming from that, as well as if there's any sort of necrosis of the skin, then you're going to have the smell coming from that too. Causative agents, it can be a whole slew, right? We don't know what the heck is in that bite. It could be any mess of different bacterium. So we're going to probably have to treat with a broad spectrum antibiotic at first and see if that doesn't clear it up, clean out the wound, any sort of lancing that needs to be done to essentially clean it up, try to heal it. Broad spectrum, because again, we don't know what it is. Now, over time, if it continues to be a problem, then we have to try to identify what we're missing from the antibiotics, what the antibiotics aren't necessarily hitting. So pathogenesis, pretty straightforward. Bite wound introduced the microbes into the sterile areas of the tissue. The crushed tissue could possibly allow for anaerobic bacteria to grow because that crushed tissue is now dead. Yeah, potentially it needs to be cleaned up and new tissue needs to be reintroduced there. So during that time, anaerobic bacteria can get into that area and establish infection. And sometimes we actually get synergistic infections where two or more bacteria that you might be infected with are actually working together to increase the disease signs and symptoms that the person has. So this can be very problematic for that individual, especially if those two different bacteria are producing toxins and both of them are producing. And so we have, basically two fronts we're trying to fight. Epidemiology, well, don't put yourself in a situation where you get bit. Ultimately results from fights, usually related to drunkenness or during forcible restraint. Poor mouth hygiene is always going to be an increased risk, so don't get bit by somebody that doesn't brush their teeth.
Elderly.
But some elderly people, yep, a lot, yep. But, as a personal story, I tried to stop a fight out here in Building 1 about 5 years ago and got bit myself by one of the students. And actually, I put made the mistake of putting my arm between two women that were fighting and pulling their hair out and tried to block them up, and she bit me right there, and I was so close, but did it, restrained, and I let go, and there was blood, and I'm like, so it happens, right? And I had to go through workman's comp and get sent to urgent care and have shots done and clean the wound, even though it was very minor, but again, you never know because human bites can always be pretty dangerous. And so she's sitting on her butt at home, banned from school for 7 years. 7 years suspension from all LCTCS schools for a bit of faculty member.
Yeah. Oh, that's good.
They wanted me to press charges, and I said no. I think losing your ability to come to school is bad enough.
Oh my gosh.
So anyway, personal story. So sometimes it's not necessarily drunkenness, right? Sometimes you just get bit. Now I know better than to try to be the peacemaker. So the next, everybody else just, as a reminder, get them on camera, so that's never good. All the students are sitting there with their camera phones filming it instead of helping. That was always pleasant too. Anyway, so the next one here, Pasteurella mollicida, is another bacterial infection that comes from bite wounds. So this is a very specific wound, or very specific infection that comes from bite wounds. And this is going to be one that needs to be it has to be treated quickly, or it can lead to sepsis or permanent loss of function of extremities if it's able to linger or to just sit there and fester. So causative agent, bacteria, Pasteurella mollicida, gram-negative, anaerobic, facultative anaerobe. So again, notice all these are kind of fitting into paradigm of being anaerobes. Detailed unknown pathogenesis. Some strains produce a toxin that can mess with protein synthesis or cell cycle, but some don't carry that toxin, so the toxin is not necessary for the disease symptoms that we see universally with people that are infected with this. So humans and a lot of other animals carry this particular bacteria as part of their normal microbiota, and cats are going to carry it more than dogs. So cat people, again, cats tend to bite more than dogs for the most part, at least in my experience. So here's one we worry about more with people that own cats, especially angry cats. And so they could be passed on just from little bites and, ultimately pass that bacteria down into the sterile tissue, and you get these signs and symptoms. Susceptible to penicillin, so that's good. Anybody that comes in with a particular wound, we can just give them a beta-lactam drug, as part of the treatment process. They come in with bite wounds, enough that made them want to come in and get treatment. We can send them home with beta-lactam type drugs, and they'll be fine, hopefully. But some cases actually do have the beta-lactamase producing Staph aureus. So again, this would be a synergistic infection. So the Staph aureus is actually producing the beta-lactamase that's knocking out the drug, and then protecting the Pasteurella at the same time. It's not necessarily Pasteurella protecting itself; it's the Staph aureus that's in there with it. No vaccines, just need to immediately clean, get quick medical attention if you have a serious animal bite, just to make sure everything's cool, clean out the infection or clean out the wound and go on some antibiotic to minimize any sort of chance that you can develop something. So here, cat scratch fever, caused by a bacterium called Bartonella henicellae. Always get that one wrong. But this is called, obviously from its name, right? It's not a Ted Nugent song. It's a actual disease. For those of you old enough to know what that was. But ultimately, Bartonella, this is cat scratch disease, and so it's going to be from getting a scratch or a bite from a cat. So this is going to be part of its normal microbiota being passed on into the wound. And so what it starts as is pus-filled pimples that appear around the wound about a week or so later. And again, when you think about those pimples, that's going to be the infection, that's going to be the neutrophils and the immune system coming in and fighting off that particular bacteria and basically sequestering it. Within a few weeks, though, it can spread to the lymph nodes. So again, the immune system, where does it take it next? It takes it to the lymph nodes. So now it's brought that bacteria to the lymph nodes, and now the lymph nodes are starting to get inflamed and swollen. And the patient will then start developing fever. Lymph nodes may be pus-filled and soft, so they're going to need some attention. Sometimes we got lymphatic drainage massage that they can do to help try to press that lymph through. Otherwise it's going to just sit there and be painful and swollen until hopefully it clears. Generally, the symptoms are all going to disappear even without treatment within a couple months. Virulence factors aren't known, right? And that goes back to the idea that we do not have a lot of people with this disease. It's not a fatal disease. Therefore, there's not a big drive for research into it. So the factors are pretty much unknown. But we do know it comes traditionally from cat bites or scratches. And if the cat is able to, is tested, if we're serious enough about trying to figure out if it really did come from a particular cat, we can test for it and determine if it's part of that cat's normal microbiota or it's carrying it in its saliva. So it occurs worldwide. We see it everywhere, often going to be in children and young adults, mainly in children because they roughhouse animals. And so the animal's going to be more likely to bite or scratch a child. Zoonotic of cats. So obviously remember, zoonosis means it's a disease that's found in more than one, more than just humans, found in animals. So zoonotic here, it's a cat disease that can be transmitted to humans, but mainly going to be transmitted cat to cat by fleas. So the flea is what's actually biting the cat, transmits the bacteria to another cat, and that's how it passes along. Humans are a dead-end host. We're not supposed to have this disease, or we haven't manifested or evolved with this disease. So when a human gets it, we're the end host. We can't pass it on to anybody else. Treatment and prevention: clean it up, ampicillin, avoid random animals. All right, rat bite fever, right? Yes, again, notice that these are kind of random, weird ones, not that we necessarily see, but that's because we're really just looking at wound infections, things that we see just mainly happening in wounds. So this one here, yet again, a bite wound. 2 to 10 days later, the person will start developing chills, fever, head and muscle aches, vomiting. Problem with this is that they may not realize it came from that bite, right? Because it's almost a week later, so they may not put that connection together that they're related. Fever comes and goes, so it's very cyclic. So you might get a fever and then you get chills and then get a fever again. And so this is going to look more like flu. So again, maybe difficult for them to relate that it came from that disease, from that bite. Causative agent, Streptobacillus monoformis. Again, an anaerobe or facultative anaerobe in this case. That means it prefers to be anaerobic. And pathogenesis enters through a bite. Recovery within a couple weeks, can sometimes be fatal, but that's only going to be in immunocompromised people. So this comes from rodents that carry this particular bacterium as part of their normal microbiota. Rat bites are pretty common in urban areas, especially among in poor areas where they may not have the best of living conditions. Rats tend to, live within filth and whatnot, especially in big buildings where they're not very well cared for. And so these could be of no consequence of their own, except for they just live in a bad area, bad house, bad apartment building, whatever. They may be sleeping, rat comes and bites them. So it's not like they're sitting there messing with the rat. It just ends up getting to them. It could also be pet animals because a lot of the pet rats that you go buy at places like Petco or PetSmart are not necessarily tested for this because it is part of their normal microbiota. So there's really no reason that you would think that it wouldn't have it. So it could be from pet animals too that we see this come from. Epidemics, which is kind of the gross part. Again, you may live in a very clean house and never seen a rat in your life. You may never want one as a pet, but again, there's always a chance that you can still get this, and it comes from consumption of food or liquids that have been contaminated by rodent feces, and this comes from the kitchen areas, right? So, yeah, kitchens are gross for the most part. If you've never gone into any of the French Quarter kitchens, I advise you never to do that. Or be a health inspector. I did that for about half a month and decided it wasn't for me. Treatment and prevention, penicillin. Again, all these wound infections for the most part, except for things like tetanus and gas gangrene. A lot of these wound infections, remember, are just bacteria that are in places that they shouldn't be. And when they get into places they shouldn't be, they just need to be cleared out. So a lot of these have not developed to be resistant to antibiotics because they're not normally treated with antibiotics because they're not normally causing disease. So almost all these wound infections can be treated with penicillin because it's not something that's universally used a lot with these particular diseases. Control wild rat populations, of course, if you can prevent getting bit, that's always a good thing. Care and handling laboratory rats and feces. When I had animals for animal models in our infectious disease work, we never really handled them. We had veterinary technicians that took care of all that for us, people that are well trained and understand and can care for the animals, and we would pay them for that just through our grants and whatnot. So luckily, we didn't necessarily have to worry about them. That's usually the right way to do it. If you're using animals and experimental models and whatnot, you have vets that help take care of them. Try to minimize these problems. All right, so switching gears into fungal infections, just a couple slides left in this chapter before we switch over to digestive. These are going to be a little bit more serious than the normal skin mycosis that we've seen before because these are actually getting in deeper, right? The fungal infections you see in the skin, ringworm, things like this are going to be just on the surface, pretty easy to clear with OTCs. Here, these are going to be fungal infections that get in a little bit deeper. So the first one here is porotrichosis. This is Rose Gardner's disease, usually in elderly people, where we see it the most, again, a little bit more immunocompromised. And what occurs here is going to be from people that are out working, as the name sounds, like working in the garden. What is it that roses have? Thorns. So the thorns are what's actually causing the wound. And there's going to be people that are like working in the garden with no gloves on or protection or whatnot. And so they get a thorn that causes a wound and actually introduces this fungus, Sporothrix shikinicky, is going to be it's a weird one. It's a causative agent, and so what it does is just like all these others. You put that organism down lower behind underneath the skin and mucous membranes. It's going to start growing in this sterile area, and what starts happening is the wound site, wherever the wound is, whether it be on the legs or on the arm, it's going to form an ulcer there. And that ulcer is going to start slowly moving towards the center of the skin. So they'll actually start seeing multiple ulcers. So the first one here is probably down here closer to the hand. But we can see 1, 2, 3, 4, 5, 6, 7, 8. They're slowly crawling up to the core. And that's just because it's being carried by the lymphatic system. And it's slowly making its way up. Usually it's very intimidating, right, to see something like that on yourself. But at the end of the day, it's not necessarily fatal unless you're severely immunocompromised. So the spores enter the body through the injury. Within a couple of weeks, those first pimples start forming. They start enlarging, ulcerating, which essentially means that they split open and you start getting the pus and seepage happening. Produces painless red lesions. So again, there's not a lot of pain associated with it, as much as it looks like it should be. And that's going to continue on every week or so. It's just going to continue getting closer and closer to the core of the body. And usually doesn't proceed beyond the lymph nodes. Once it makes it to the lymph nodes, the immune system wipes it out and it's done. But that can take years sometimes for it to completely clear out where the person is no longer having these ulcerations happening without treatment. With treatment, we can get it cleared pretty easily. It's an occupational risk for people that work in gardening centers, nurseries, and found pretty much worldwide. So it's nothing that we can get away from. So treatment's usually going to be through, we haven't really talked about a lot of treatments for fungal infections, but potassium iodide is a common treatment for fungal infections. So here, sort of like taking penicillin, right? We can't use penicillin here because it's a fungus. But potassium iodide is basically the fungal version of penicillin. It's one of the most basic anti-mycosis medicines we have out there. Spit it out. All right, so here the last slide for chapter 23 is just a collection of all the diseases we talked about in this chapter. So yet again, good spot to start when you go back to review, just making sure that you've covered all of them. So any potential test question you at least have heard of before. All right, so I'm going to